Helo, diolch am wrando. Fy enw I yw Nesta Mccluskey, a rwyf eisiau annog I chi feddwl am yr iaith yr ydym yn ei ddefnyddio a sut mae cleifion yn dygymod pan nad ydym yn ei trin yn ei mamiaith, neu'n ei trin mewn iaith sy'n estron iddynt. Rwyf am rannu 2 stori I ddisgrifio sefyllfaoedd hollol wahanol, un da ac un drwg. How did that feel? For those of you who don't speak and understand Welsh, how does it feel not to understand? Now imagine how that would feel in a healthcare setting where you might be anxious for yourself or someone else. I'm going to tell you 2 stories. The story of Mabon, my fabulous youngest son, and the story of Derry, my fabulous oldest son. Both stories have much in common. They took place with me present, in healthcare settings, and involved the Welsh language. There is one stark difference. One was stressful and difficult, one was calm and patient. My boys are bilingual. They've been brought up speaking Welsh and English interchangeably. Welsh with me, English with their Irish father. Both languages with their wider family, friends, and in school. Important to note is that their natural language with me, their mother tongue, is Welsh. I'm sure if my husband had been with them, the stories would have been different. Imagine the scene. A sunny evening and a cute little 7-year-old boy in his beaver's uniform running around the garden. Mabon had fallen on a camping trip the weekend before and sod's law tripped and landed on the same knee directly onto a rock. When you know, you know. There was no way that the cut on his knee was just going to need a plaster and a kiss. He needed a minor injuries unit for some attention. Luckily, there's one just up the road. Mabs was quite anxious as a 7-year-old, so by the time we arrive, we're both well covered in snot, blood and tears. Being a Monday evening, there wasn't much of a queue, so we were pretty much straight into the treatment room, where I explained the evening's events. Speaking to the nurse in English, reassuring and explaining to Mabs in Welsh. "What's that gobbledygook you're speaking?" asked the nurse. "Is it Welsh?" I become very British. I apologise and explain, yes, it's Welsh. I explain that Mabon does speak English, but that he and I speak Welsh to each other. We continue. As the nurse approaches Mabon's bloodied knee with a pair of scissors to cut off the skin flap, no explanation given, Mabs panicked. Again, I reassured him, but bilingually now, he replied to me in Welsh. "It's not fair on me," said the nurse. "I don't know what you're saying." By now, she's fallen to the very bottom of my Christmas card list. Soon enough, steri strips and a dressing in place, and clutching his new red teddy that the nurse gave him for being brave, Mabon was merrily chatting away to the nurse in English. Stress over, normal language skills restored. My blood pressure through the roof. Mabon was fine, I was fuming. Instead of being able to focus on the needs of my distressed child, I'd had to manage the needs of the nurse. Somehow she perceived herself to be vulnerable within this encounter. Her clinical care was faultless, but her manner made me feel guilty for speaking to my child in our natural language. I wonder what it was that made her feel vulnerable. A poor experience. Next, the story of Derry. This happened when he was 16. Derry, a bright, intelligent student, bilingual from birth, had developed awful acne. It broke my heart when he told me how sometimes he couldn't sleep, partly because of the pain on his face and partly how he looked. He tried all the over-the-counter remedies, restricted his diet, and eventually we went to the GP. The GP was great. Started him on antibiotics and referred him to dermatology. Derry, 6'2", looked a bit out of place in the paediatric outpatient department. He had to dodge the Easter decorations hanging from the ceiling. In the consultation, Dr. Yasudian took a detailed history, looked at Derry's skin, and proposed a treatment regime. The treatment regime had risks. Isotretinoin has side effects for the liver, joints, and mood. Dr. Yasudian asked Derry, in English, what he wanted to do. At this point, Derry lost his English. What happened next was a 3-way conversation. Doctor speaking to Derry in English, Derry speaking to me in Welsh, me speaking to the doctor in English. At no point was a comment made about this. The consultation flowed, the treatment plan was developed, and Derry was fully involved. Dr. Yusudian was patient, compassionate, and understanding. As a mum, I was reassured. I didn't feel the need to explain anything about our language. I could focus on Derry's needs as he absorbed the information. As we left, Derry thanked Dr. Yusudian in English, and on the way home, in the car, turned to me and said in Welsh, "Well, clearly I can't speak English when I'm stressed," but a great experience. Whilst preparing this talk, Anna, a colleague on the climb cohort, shared with me that she had worked in a field hospital during COVID. Can you imagine a more stressful environment to be as a patient? She told me about an elderly patient who lost their English due to stress. Anna doesn't speak Welsh, but she knew that the domestic did. Anna made the link and the patient gained their voice. Their stress was reduced. They could speak again. Some conditions can result in sudden changes in language skills. Post-stroke, previously fluent, bilingual people may revert to their mother tongue. As a newly qualified physio, I recall a patient being labelled as confused who had actually lost her English and reverted to Welsh in the aftermath of her stroke. Why am I telling you this? Do I want you all to learn Welsh? No. And it's not actually just about the Welsh language. Beth amdanoch chi, y Cymry Cymraeg, sydd ar gallu siarad iaith y nefoedd yn ogystal â'r Saesneg? Sut aeth hi y tro diwethaf i glaf dod atoch nad oedd yn medru Cymraeg na Saesneg? A wnaethoch chi pob dim yn amyneddgar? Tydw i heb fod yn amyneddgar pob tro, dim da lle ellir gwell. About 7% of school-aged children in Wales have English as an additional language. Their language skills will vary from no English language skills to acquiring English language skills. 7%, about 26,000 children. 8% of adults in England and Wales reported in 2011 that English was not their main language, again ranging from some to no English skills. 8%, over 4 million people, more than the population of Wales. All I ask is that you consider language, especially in a stressful situation. What resources do you have available? Do you know? As my boys show, fluent English speakers can lose their English language when stressed. What I ask is that you be more Dr. Yusudian and less the nurse in MIU. Patience and the use of resources available can make a huge difference to well-being and patient outcomes. Don't assume that someone does or does not understand. As my stories show, Derry could understand but not communicate back in English. Parents, even stressed ones, language line, translators, a colleague, or just time, patience and smiles can make a huge difference. And not just with patients. What about our colleagues with English as an additional language? They too may struggle with their language skills when stressed. In an interview perhaps, or after a stressful day, or simply because the words just won't come. Caroline Hill writes about the big 10 ideas that fuel oppression. Idea number 7 on the list is that English speakers with dominant culture accents are more intelligent than non-English speakers or those with different accents. She writes that these ideas fuel oppression by making it easy for us to create physical, emotional and spiritual distance from each other. Thousands of people in our work and home communities speak great English as an additional language. I'm simply asking for some compassion for them when their words sometimes get lost. So to close the loop, Mabon, soon to be 16, has a great collection of scars from his multiple adventures. Derry, soon to be 18, has lovely clear skin and has regular follow-ups with Dr. Yusudian where they speak to each other in English. I know how fluent my boys are in English. I know firsthand what happened under stress. I'm certain you will encounter people, colleagues or patients who have English as an additional language and hope that my stories will help you reflect upon how your response and ability to be compassionate will make a huge difference. Diolch am wrando.